Hello everyone, it's Monday and you're watching Within the Frame. I'm Kim Bo-kyung. From pandemic to endemic, last Thursday at a meeting of the Central Disaster Safety and Countermeasure Headquarters, President Yoon Suk Yeol said that from June 1st, South Korea will lower the classification of COVID-19 to alert from serious, which was the top level of the four-tier system for coping with infectious diseases. Major COVID-19 restrictions will be lifted, enabling people to return to normal lives after around 3 years and 4 months. But are there still aspects that we should be worried about? And how will COVID-19 as an endemic virus be handled differently? For an in-depth analysis, we invite into the studio Professor Kim Moon Kyu from Yonsei University College of Medicine. Professor Kim, welcome to the show.
Thank you for having me.
And we also have Dr. Ellis Tan, internist at MizMedi Women's Hospital. Good to see you, Dr. Tan.
Thank you for having me.
All right, Dr. Tan, first question to you. The World Health Organization has said COVID-19 is no longer a global health emergency, and reflecting such decision, South Korea also declared an end to COVID-19 as a health emergency last Thursday. What criteria were considered in order for such a declaration to be made?
Right, the most important criteria were the impact of COVID-19 on individual health and also healthcare capacity. So over the last 4 weeks, the average number of daily deaths due to COVID-19 was consistently less than 10. So we have an average of 7 deaths per day, giving a mortality rate of 0.06%. And so even though every single death is a significant loss, the loss of a family member, a loved one, overall the significance and the impact of the disease is now manageable enough that we can progress to the next phase of managing this disease. Also, they looked at healthcare capacity, and here in Korea, we do have stable and sufficient healthcare capacity to deal with the current situation of COVID-19. And so those were the two major criteria that they looked at. They also looked in terms of what's on the horizon, if there was any potential new variant virus that could make us want to raise our alert level. But right now, there does not seem to be a variant of concern on the horizon that would warrant an elevated alert level. So that's why the South Korean government decided to, from June 1st, decrease our emergency status in line with what the WHO has recommended.
Right, I see. So those were criteria considered. Now, Professor Kim, as Seoul lowers the national crisis level for COVID-19 from serious to alert, it marked a de facto transition of the virus to endemic disease. I wonder, how is being endemic different from pandemic, and how is it managed differently?
Well, everybody know what pandemic is, worldwide spreading of this infection. And there's another word, epidemic, which means infection is spreading in a specific area only. But now we are entering the endemic phase of this COVID-19, which means it's like kind of a baseline status, and it's present in the community, not only in Korea, all around the world. And sometimes it's hard to trace from whom the patient got infected. For example, the seasonal flu is kind of endemic. Always we meet, and it's a kind of a part of a normal variation. But this does not always go one way. I mean, it's not a one-way door. I mean, sometimes we go to endemic and it might turn back to pandemic. So we have to be vigilant. And we have to follow up the local cases of this daily tally and keep an eye on it. So now, after June, the isolation day from 7 days will turn to 5 days. And hospitals and nursing homes might still maintain wearing masks, and the health workers need to test if they have symptoms for COVID-19. And visitors can have a meal with the patient, which was prohibited. It's not necessary to do the PCR test after 3 days entering our country. So that's the difference from pandemic to endemic.
Right, I see. Now, Dr. Tan, following the declaration, like our Professor Kim pointed out, there will be major changes starting June 1st. And let's delve deeper into the specifics. As part of such changes, the isolation period will be reduced from the current 7 mandatory days to a recommended 5 days. But is it safe not to have an obligatory isolation period? And what measures should be in place to guarantee people's right to rest?
That's a really good question. So, from a public health perspective, but also an individual health perspective, it's a good idea to stay at home if you have acute COVID infection. We know from very detailed epidemiological data done here in South Korea that it only takes a few days for this infection to spread down chains of transmission from someone who may be healthy and asymptomatic to eventually infecting someone who is at high risk and who could develop very severe disease because of COVID-19. So the government acknowledges that here in South Korea, there may be cultural barriers and financial barriers that prevent people from staying at home if they are acutely ill. So they are asking community engagement in this regard. So we want leaders at schools, in workplaces to set a good example. And also to encourage their workers and students to stay at home if they are sick. The government is planning on launching a policy of paid sick leave for anyone who is acutely ill with COVID-19. And there should be a plan in place at schools, universities, elementary schools, hagwons, for catch-up learning for any students who might be acutely ill. So this does take a government effort, but also an effort from community leaders and also teachers, parents, everyone to sort of acknowledge that we need to all do our part to try to limit transmission because COVID-19 is still widely prevalent and there are still people who are at risk for severe disease.
Right, I see. So all around efforts will be needed. Now, Professor Kim, though the mask mandate will remain in place for large hospitals with more than 30 hospital beds and medical facilities for high-risk groups, like you said before, it still seems high-risk groups could be vulnerable to COVID-19. I mean, what kind of preventive measures could they be adhered to prevent themselves from catching COVID-19?
Well, as I work in emergency department, I think I'm going to wear the mask as far as I'm on duty. And I think it'll be different from situations for what situation the workers are in or the patients are in. So right now, we do not test the COVID-19 test for every patient who have respiratory symptom or fever. It is highly indicated if the patient have underlying conditions such as cancer, obesity, diabetes, and heart disease, kidney disease, etc. And if we have a family member who has an underlying condition, that might be another indication that the patient might need the test to prevent spreading COVID-19 to a family member who is at risk. And if the patient needs to be admitted to hospital, it's mandatory to the COVID-19 because even though the patient might not have fever, but might start having symptoms after admission and spread in the inside the hospital, which sometimes end up in a very critical situation.
Right.
If another patient next to him has a underlying condition. So for people who might belong to the high-risk group, need to do the vaccination, and might have to wear a mask if he must go to a place, a very crowded place, or gonna meet somebody who might have a fever or coughing. And everybody needs to continue with hand hygiene. And I think there needs to be an early intervention if the patient at high risk have symptoms.
I see. Now, Dr. Tan, last week, the country saw around 20,000 new cases a day, and with the XBB subvariant being the most dominant one, some experts worry another surge could come as early as June, with the number of infections rising to around 30,000 to 40,000 a day. Could such a surge be managed?
Well, here in South Korea, we do have a goal of having enough healthcare capacity and resources to manage 1 million new cases per day. That was the government's stated goal. During the peak of Omicron, we did have more than 500,000 new cases per day. That was the record. But it was difficult during that time to manage all of our cases. We do have, I think, enough of an immunity wall against COVID-19 through vaccination and also through natural infection, such that even if XBB.1.16 were to spread, I don't think that it will lead to a high level of impact. That's what I talked about before. So severe cases that lead to hospitalizations, ICU admissions, and deaths. That being said, we do need to be vigilant. We need to keep up our surveillance efforts and make sure that we don't let off the gas pedal in terms of what we're doing with PCR testing, community testing, making sure that we keep certain measures accessible to the public in terms of financing, government subsidies. They will continue to subsidize PCR testing for people who need it, treatments, and also in terms of subsidizing hospital costs. The government has committed to even beyond June 6th to support anyone who needs treatment for COVID-19.
Right, I see your point. Now, Professor Kim, moving on to the vaccination front, I know that our Dr. Tan already talked about how we do have enough immunity wall, but I'd like to ask you, is South Korea's current vaccination status favorable, and do we not have to worry about the vaccine effects that might wane over time?
Definitely it wanes over time, and especially there are some people, group of people who needs monitoring, needs vaccination. The patient who have cancer and on chemotherapy, they gonna need vaccinations. Any people undergoing immunosuppressive drug therapy because of transplantation or whatever. And if the patient is post-transplantation for 2 years, 2 years after transplantation, the immunity is very weak, and if the patient get COVID-19, he's going to end up in a very serious situation. And there are rare disease which is a primary immune deficiency syndrome, only in the children. They need a lot of care for that. And finally, there are patients who need a very high dose of steroid therapy. Steroid causes immune suppression, and if the patient catch COVID-19 at the time of this high dose steroid therapy, it might end up in a very serious COVID-19 infection. So those patients need to be monitored and need a vaccination more than other people. Now we have bivalent vaccines, RNA vaccines. And if the patient is more than 12 years old, you can get it. And if you don't want RNA vaccine, you have another choice from Novavax or SkyCovid-1. And the recommended interval is about 3 to 6 months after the previous vaccination. So if you think that you're reaching the 6 months after the previous vaccination, you better visit and get a vaccination. And it's going to be from today to the end of June. This vaccine period is open, so you can go and get vaccinated.
Right, I see. Now, Dr. Tan, I'd like to also talk about the tasks that remain after the COVID-19 pandemic. The virus has been with us for over 3 years, and more people are suffering from depression and obesity as well. What are the figures like for those problems, and how should such issues be tackled?
You know, that's a really great question. I think you're speaking to post-acute COVID syndromes. And unfortunately, here in South Korea, we don't have a whole lot of published data in the medical literature about symptoms and patients with long COVID. There is an ongoing study carried out by the Korean NIH looking into long COVID in 1,000 patients, but that study, in terms of the published findings, we don't have them quite yet. What we do know from the published literature is that neurocognitive and psychiatric symptoms do play a prominent role in terms of the symptoms that patients are complaining of in the long term. These include brain fog, difficulty with concentration, anxiety, and depression. And so in terms of dealing with these mental health issues and also neurocognitive issues, we will need, I think, more dedicated personnel to deal with them. I know one colleague mentioned that at her hospital, the hospital actually set aside half a day, 1 day a week, to deal with the stress and neurocognitive and psychiatric complaints of all of their healthcare employees in that hospital. And so they were able to, the healthcare workers were able to access counseling very easily. I thought this was a brilliant idea to help with healthcare workers who may be dealing with stress. So I think accessibility and also training healthcare workers, psychiatric healthcare workers in particular, deal with the mental health crisis that might ensue because of long COVID is really a needed area of focus right now. In terms of obesity, the obesity epidemic in South Korea, this predates the pandemic. So it's really hard to say that COVID-19 is a causal factor for increased obesity, but it is something that needs to be examined. We do suspect, however, in terms of cardiovascular risk, there does seem to be an increase in cardiovascular disease as a result of long COVID. There's this big study that was done in the United States that explored this one long COVID potential side effect. And the study that's carried out in South Korea by the Korean NIH may clarify whether or not COVID infection leads to an increased risk of acute myocardial infarction and stroke in the Korean population as well.
Right, I see. Dr. Tan, one more question to you here. Health authorities say the period of time before another pandemic hits could be shorter and have discussed long-term ways to tackle a future COVID-19 or similar outbreak. What were they and what should be the most highlighted?
So this is the most important question of the day, I think, is how do we prepare for the next pandemic? Because it's not a matter of if another pandemic will come, it's a matter of when. And as you mentioned, it seems like the interval between pandemics is getting shorter and shorter. So there are 4 key words that agencies such as the WHO are stressing in terms of how do we design our preparedness and response plans for the next pandemic. And those words are, it needs to be a rapid response, coordination, cooperation, and integrated as well. And equity needs to be built into the design of any plan we have for a pandemic response from the beginning. It's been made very clear that the first 100 days, the response of a country can really define the trajectory of a pandemic going forward. And one goal that's been put forward by CEPI and also acknowledged by the Korean government is we should have very specific vaccines for a new pathogen within 100 days of the next pandemic. And so in order to have a vaccine available very quickly, of course, we're going to have to examine potential pathogens right now, have candidate vaccines ready on the shelf, and also do surveillance globally to make sure that we catch early signals of a pandemic if it were to arise. Also, within the first 200 days, we want to have an antiviral agent ready. And so this is going to take a coordinated response among all stakeholders, the public sector and also the private sector, to get antiviral therapeutics and also non-specific but supportive therapeutics ready. So we have a lot of work to do, but we do have good ideas in terms of what needs to be done.
Right. We do need to remember, like our Dr. Tan says, it is not a matter of if, but it's a matter of when. Right. running out of question, and we are running out of time, but I do really want to ask this question to our Professor Kim. Now, according to the KDCA, 23.7 out of 1,000 patients who visited medical centers for the first week of May had flu symptoms, which is an increase for 7 weeks in a row. Now, what should people know to protect themselves from these respiratory illnesses?
Since the pandemic, everything has changed. Annually, we usually have a pattern of flu, influenza, and there are two types actually. Influenza A is prevalent in the early winters, and then as time goes by the end of this winter, we have a surge of influenza B. But from 2022 to 2023, we just had a influenza A, and suddenly it started to decline. And nowadays we have another surge of influenza A. We didn't have a surge of influenza B. And this May season is not a season to have influenza. So when a patient with fever comes to the clinic, we have to decide whether he needs influenza test or COVID-19 test. And sometimes we have to do the both in situations. So it's a very strange phenomenon, and usually influenza has a more abrupt onset of symptoms with muscle pains. So we prefer influenza test for those patients. And you don't know what you're going to get. So I recommend people to have enough water and have enough sleep with good quality, and get tested for influenza if you think that all the symptoms started suddenly with muscle pain.
Right, we should all note that. Right, I'd like to ask more questions to our experts, but unfortunately this is all the time we have for today's edition. But thank you, Dr. Tan and Professor Kim, for your insights. We really appreciate it.
Thank you.
All right, that's all for Within the Frame tonight. We'll be back tomorrow with more in-depth stories. Thank you for watching, and goodbye.